When we talk about a chronic illness, it's so easy to get stuck on the medical jargon, right? The biology, the treatments, the clinical side of it all. But today, we're going to peel back those layers. We're going to look at the human side of the story, what it's really like to live with a condition day in and day out. And that really gets to the heart of it, doesn't it? What is the true cost? Because it's not just about the money, not by a long shot. It's about the daily grind, the emotional weight, and how it touches every single part of a person's life. Okay, so to really dig into that cost, we first need to understand the disease at the center of all this, thalassemia. So, what is it? Well, in a nutshell, thalassemia is a genetic blood disorder. It messes with your hemoglobin. That's the protein in your red blood cells that carries oxygen. The results? Anemia, and a whole bunch of other complications. And listen, this isn't some super rare thing. The World Health Organization says it's a common chronic disease in 60 countries, especially in places like the Mediterranean, the Middle East, and a big one, Southeast Asia. All right, so we've got the big picture. Now, let's zoom in. Let's get personal. We're going to focus on a study out of Bangladesh that did something really important. It just listened to the patients. The researchers talked to 356 thalassemia patients, chosen at random, to really get a handle on their reality. We're not talking about just looking at their medical charts. We're talking about their actual day-to-day lived experiences. So who were these 356 people? This is where the story really starts to take shape. The average age was just under 20. Think about that. So young. Over half were students, just trying to get an education and build a future. And here's the kicker, a really crucial piece of the puzzle. More than half of them came from low-income families. Remember that detail, because it's going to be a huge deal later on. And let me tell you, their medical situation was intense. A massive 91% of them needed regular blood transfusions just to stay healthy. Over half had a severe form of the disease. And on top of that, more than a quarter were dealing with other chronic health problems too. So yeah, this is a daily battle for sure. Okay, so you might be wondering, how on earth do you even measure something as personal and subjective as quality of life? It seems impossible, right? Well, the researchers actually had a tool for that. They used a standard survey. It's called the SF-36. It basically asks patients a whole range of questions about their physical health, any pain they're in, their mental state, their social life. You get the idea. It then crunches all those answers into scores, giving us a real, quantifiable look at their well-being across 8 different areas. And when they crunched the numbers, one interesting thing popped out: a difference between the genders. You're looking at the scores for bodily pain. Male patients actually reported higher scores. Now, this is one of those times where a higher score is a good thing. It means they reported feeling less pain than the female patients in the study. But, and this is a really important but, let's not get too hung up on that one data point. Because when you zoom out and look at the whole picture, the story was one of universal struggle. For most of the other areas they measured, there were no big differences. The main takeaway here is that thalassemia just hammers the quality of life for everyone, no matter their gender. So that brings us to the real heart of the study. What is it that makes this already difficult life even harder? What factors were most closely tied to a lower quality of life? Let's start with a number, $560 US. That was the average medical bill for these patients for 1 year. Now, depending on where you're listening from, that might not sound like a crazy amount of money. But context is everything. Because remember what we said a minute ago? Over half of these families were already living on a low income. So that $560, it's not just a medical bill. For many, it's a totally crippling financial weight that can put essential care just out of reach. And when the researchers put all this data under the microscope, a really clear pattern started to show. The things that consistently pointed to a lower quality of life were, well, some things you'd expect, how severe the disease was, or if they had other health problems. But woven into all of that were the economic realities, having a lower family income, facing those high medical costs, and needing those frequent and expensive blood transfusions. Honestly, the study's authors said it best. These financial problems aren't a separate issue. They are a direct cause of people's health getting worse. If you can't afford treatment on time, your physical and mental health is going to suffer. It's just a devastating cycle. Okay, so with all that on the table, what's the solution? What's the way forward? Because the great thing about this study is that it doesn't just point out the problem, it actually offers some ideas for solutions. And really, the main takeaway is this: Real patient care has to be holistic. It can't just be about medicine and doctor's appointments. You have to look at the whole person and their whole situation. So the researchers laid out some actual, concrete steps. 1, make healthcare services more flexible and centered around the patient to cut down on the time and travel burden. 2, bring in counseling and psychological support for both patients and their families. 3, find ways to actively help families with that crushing financial stress. And finally, we've got to look to the future, right? To new therapies like gene and stem cell therapy that might one day offer a real cure. And all of this leaves us with a final, bigger thought. This study, yeah, it's about 356 people in Bangladesh, but it tells a universal story about what it means to live with a chronic illness. It shows us that true care is so much more than medicine. It's about building a web of support, financial, social, emotional, that helps people not just survive, but actually live with dignity. And it makes you wonder, doesn't it? How can we all do a better job of that in our own communities?